Hi, we're here today with Lucy Postolov, licensed acupuncturist and herbologist, and we're going to discuss briefly her favorite treatment, and that's helping women get pregnant.
The reason it's my favorite treatment because I went through 6 years of infertility myself, and now I have a 30-year-old daughter who is a medical doctor in Stanford. So all this hard work pays off for all those women who cry every month when they see a drop of blood. I'm telling you, it's worth it. It's so rewarding for me as a professional. Acupuncture works in a miraculous way to help women who are suffering with infertility, but not only women, men as well. I always treat couples. If it is a male infertility, usually we're dealing with the problem of sperm count, spermatomotility, morphology. And it takes 3 months to improve the semen of a man, because that's how long it takes for the whole morphology cycle of spermatozoa. Woman, after she starts menstruating, releases an egg every single month. So we have to work on her cycle, on her estrogen, on her progesterone, on ovulation, on release of the egg. And acupuncture, by increasing the flow to the pelvic area, by balancing hormones, is helping women to get pregnant.
Lucy, who would be a good candidate for acupuncture for infertility problems?
I have all sorts of women who come to me. Some women want to get pregnant naturally. They don't want to go through IVF procedure. And I would take that case if I know that there are no organic issues, that there are no fibroid, there are tubes are open. If it's only a hormonal cycle, then I'm going to say, yes, we can work with natural way. However, if there are some organic problems, we have to work with Western medical doctors. It also depends on the age of a woman. If the woman is in her 40s, we don't have the luxury of time. So at that point, I would say, let's do the combination of Eastern and Western medicine. So sometimes I work just with the patient. Sometimes I will work with a medical doctor where they do IUI, intrauterine insemination, or IVF, in vitro insemination. So it varies.
Lucy, are you able to determine that you're making progress with a woman, or that perhaps you're not making any progress? How can you tell?
Well, of course, the proof is in the pudding. If a woman gets pregnant, woman is pregnant, and there is a progress. And sometimes we get lucky and woman gets pregnant after 1 or 2 months after working with her. Some cases take a couple years to improve. And there are a lot of ways right now how we can check the progress. First of all, if the cycle is regular, if woman doesn't have any pain before her period, if the color of blood is normal, we usually suspect that the cycle is better. Plus, there are ovulation kits. If we're just working with the patient directly. If woman goes through IVF specialists, there are much more tools to see her progress. We are checking the level of estrogen, the level of progesterone. We do ultrasound to see how many eggs are mature, how many eggs are good, bad. There are genetic testings. There are so many different tests where we can measure the progress.
And I also know that you have experience with Cryobank and stem cells, don't you?
Yes, I do. When I came to this country, my first job was in California Cryobank, and I was working consulting patients with infertility, and it was a sperm bank, and now they also freeze eggs, embryos, and stem cells, and I was one of the first people in the California Cryobank who implemented the stem cell program.
Great. Well, Lucy, I want to thank you very much for your time today. Any words for our listeners before we go?
Of course. First of all, thank you, and be well and healthy.
Thank you, Lucy.